Hi, my name is Dr. Tiffany Leung, and I'm here today with my co-authors and amazing women physicians, Drs. Evelina Biskup and DeWitt. We're a global team, and we're based in the Netherlands, Shanghai, and Washington State in the United States. We've all had migratory journeys throughout our careers, which we'll share briefly with you today. As internists who have practiced in various international settings, we wrote this commentary in Rural and Remote Health to offer an overview of important issues encountered as international medical graduates in non-US countries. We describe key barriers faced by physician migrants when seeking licensure in a new country and offer recommendations for improvement. Physicians migrate internationally for medical school, specialty training, academic and professional opportunities. However, they often face a daunting series of procedural tasks to prove their clinical competency before being allowed to practice in a new country. Licensing regulations are intended to ensure patient safety, consistent care quality, and prevent fraudulent or criminal behavior. Unfortunately, these procedures are time-consuming and labor and resource intensive, and sometimes they really can waste talent and productivity. Do you want to go ahead and share your experience?
My journey went through Germany, United States, Switzerland, and China, where I have spent a decade now traveling between two continents.
Wonderful. And Dawn, you've practiced in Australia and Canada before returning to the US, where you're now a professor and a senior associate dean of clinical education. What about you? What's your story?
Well, my journey was a complete accident. Although I did some graduate school in the UK, I ended up practicing at the University of Washington in Seattle after training in Boston and Seattle. And then after 10 years on faculty, I ended up moving to Australia for a job as an associate dean at the University of Melbourne. The really sad thing was that moving to a workforce shortage area to start a rural program for the University of Melbourne, I couldn't believe that it took me almost 6 months to get relicensed to practice in Australia. And that was after I had worked with the American College of Physicians and the US Medical Licensing Exam, National Board of Medical Examiners, to write the national exams in the US. So it was really a shocking pause there. Then about 10 years later, I moved to Canada, and it took me another 6 to 9 months to get requalified in Canada. So it was really sad because it was a huge waste of my ability to take care of patients where I was needed.
Yeah, absolutely. And I can totally empathize with that too. So I'm in the Netherlands. I am trained as an internist fully, practiced primary care in the US for a number of years, in fact, before I moved here. It is now my 4th year in which I'm not really fully functional as a practicing physician yet, simply because of language barriers, which, as we discussed and we mentioned in our article too, that language barriers often pose a significant hurdle for international medical graduates. But beyond that also, there can be extensive and very expensive examinations involved, which is the process where I'm currently.
You know, it's really interesting about how much of a barrier language should be. And one of the things that has caught my attention is the difference between competency and capability. And we do all these tests for competency, and are you competent to practice in another country? But when I moved to Australia, the system for measurement was different. A lot of the drug names were different, but it was the practical things that I had to learn, and I had to do a lot of introspection about what am I safe to do now and where do I need help. But taking another written exam wasn't going to solve that problem for me. And I think we need to work harder at doing side-by-side coaching and mentoring rather than restricting people from getting in there and helping, however their competencies and capabilities allow them to.
I couldn't agree more. This is a very important point. If I may bring my example, I ended up in China, and the language barrier was, of course, a problem. However, not even being fluent in China, I was able to not only conduct half a year of an internship, but later on even 1 year of medical residency towards the specialty of internal medicine. I admit it was a rotation in anesthesia, so there was not much talking involved. However, it was very impressive how much the colleagues here were embracing a new colleague and helping and being one-on-one mentor. Helped so much to develop so many skills that I brought back to Europe and that were actually very much appreciated there. So while language barrier and the competency tests are important, I would fully agree, they are not crucial and not determinant.
It's one of the biggest professionalism challenges I think we face as physicians, trying to solve this international problem of workforce shortages and the need for migration of physicians, as well as for personal reasons, is how to self-regulate so that we are aware of our deficiencies and can practice safely in a different country. Our current regulatory systems, though, are much too bureaucratic, and we should be looking for different solutions.
I think this sort of global perspective that we've all developed is incredibly personally and professionally fulfilling, and is something that I hope that more are able to do. So in this commentary, we're able to express some of the challenges that we've each encountered and offer some opportunities for professional societies to be able to help with this process, and also for the regulatory bodies who are the ones in charge of professional recognition for healthcare professionals and physicians in particular.
I hope we also encourage young colleagues in general to endeavor and engage in international experiences despite many hurdles, because we have to remember that gaining this expertise in other countries is so important and so valuable at the end of the day for the patient, who should always be in the center. And secondly, the more we do it and more often we do it, and the more people experience those hurdles, perhaps we together can actually influence administrations to be not more lenient, but to find more flexible solutions or approachable solutions, applicable solutions.